If people in Taiwan have a cold, they may go to a clinic near their homes. However, it is not so easy for people living in Yemen or the Indian countryside to receive medical care. There are 17 doctors per 10,000 people in Taiwan, but only 9 in the Indian countryside. Yemen is even worse, with only 3 doctors for every 10,000 inhabitants. Such statistics explain why Médecins Sans Frontières, MSF, also known as Doctors Without Borders, was founded in 1971 to facilitate medical care for the world's poor. MSF's core mission includes setting up mobile clinics for services such as lung care and maternity, especially in conflict zones. It also offers support to under-resourced hospitals and trains local staff to continue the work after it leaves. A primary goal of MSF is to provide healthcare facilities where they do not exist or are not easily accessible. In the southern Indian state of Chhattisgarh, for example, decades of war have ruined the local health system. MSF has had mobile clinics there since 2006, caring for mothers and babies while also treating lung diseases. Thanks to these clinics, infant mortality has accordingly been reduced from 54 deaths per 1,000 births to 29. Likewise, MSF staff identify and treat patients with tuberculosis or pneumonia, as well as teach people how to prevent the spread of both diseases. Another important MSF aim is to support existing local hospitals that are seriously overcrowded. In Yemen, where conflicts have persisted for years, government clinics and hospitals are forced to operate at over 100% capacity. In these facilities, patients share beds. Since 2015, MSF has increased beds from 33 to 288 in the ABS hospital, which serves 1 million people, offering material support to 80% of the hospital's departments. Unfortunately, the health crisis in Yemen has become too great for even MSF to manage. It is sending pleas to other international organizations to help run the ABS hospital and train local staff. Besides providing clinics and supporting hospitals, as in India and Yemen, MSF plans ahead in case it should have to leave its overseas locations. By training local colleagues, MSF ensures that its clinics and supported hospitals will continue to operate effectively after it leaves. Without proper training of these local healthcare workers, all its efforts could end in failure. Therefore, it has established MSF academies for healthcare in 40 regions around the world. These academies aim to strengthen the medical skills of local workers so that, in the future, they will be able to sustain the high-quality hospital care currently provided by MSF. To date, 860 healthcare workers have graduated and another 940 are being trained. MSF's efforts include setting up clinics, supporting overcrowded hospitals, and training local medical workers. These initiatives have led to significant positive health outcomes that would not have been possible in these struggling regions otherwise. In India, for example, infant mortality has decreased by 46%, and the average lifespan has increased from 65 to 71 years. Similarly, in Yemen, tuberculosis cases have declined from 116 per 100,000 people to 48, where life expectancy has risen from 63 to 66 years. The implications of MSF's presence are clear. Countries that don't sit back but open the door to organization can tap into its priceless medical resources. Whether rich or poor, everyone deserves good health care.